Good morning. I am Dr.S Senthamizhan, General Surgeon from Athreya Hospital, Chandapura. Today I will just have a little bit discussion about what are the common conditions which may lead to the abdomen pain in a patient. First, let me discuss about what are the causes which is causing pain in the upper abdomen. Upper abdomen has three different compartments in it. First is right hypochondrium, second is epigastric, next will be left hypochondrium. The most common pain in the right hypochondrium will be the gallbladder disease and its consequence. What are the most common gallbladder disease? One will be cholelithiasis. Nothing but a stone inside the gallbladder which is happening because of hypercholesterol or prolonged stay of bile in this. It is known as cholelithiasis, which is most of the time patient will not be, pain will be a symptom. Symptom will be dyspepsia. That means patient after having food, having gastric symptom, bloating, discomfort. Those are the few symptoms which cholelithiasis will have. When the stone containing gallbladder, if get infected, it is known as cholecystitis, which may need a IV antibiotic and proper treatment. The other cause may be gastric ulcer or duodenal ulcer, can also cause pain in the right hypochondrium. Second will be the epigastric region, which is nothing but which is located in the center of your upper abdomen. The common condition which may lead to the pain in this epigastric region are, one is acute gastritis, nothing but your stomach wall will getting inflamed, which is getting too much of irritated, which is the most commonly known by a patient term known gastritis or acidity. Few are the conditions are GERD. Second will be the acute gastritis, which is nothing but the erosion of the stomach wall. The other condition which may lead to the pain in the epigastric region is more common in alcohol consumers. Those are known as acute pancreatitis. Nothing but the pancreas will just get inflamed in its size, and which may lead to the pain in the epigastric region. Very few complaints patient who may have the epigastric region and which may need an emergency treatment is acute myocardial infarction, which is nothing but an heart attack. A sudden pain in the epigastric region, which is always associated with breathlessness or shortness of breath, pain starting in the center of the chest, which is radiating to the back, it is known as acute myocardial infarction, which is commonly known as heart attack, which may need a proper and emergency treatment, or else it will be life threatening. Third, I am going to discuss about the other upper quadrant is left hypochondrium. As if in gastritis and duodenal ulcer, even the left hypochondrial pain will be there. One other complication which may lead to the left hypochondrial pain is acute trauma, which may induce a trauma to a spleen, and rupture may lead to the acute left hypochondrial pain. Okay, these are the quadrants which are located in the upper quadrant of your abdomen, which may lead to the pain in the upper abdomen. Now let me discuss a very few conditions which are commonly causing the middle part of the abdomen. Middle part of our abdomen are divided into, one is right lumbar, left lumbar. In between them located is the umbilical area. Right lumbar area, the most common condition which can cause is acute bowel ischemia. Ischemia is nothing but the bowel which is located in that area will not have blood supply, which because of compromised blood supply, patient will have acute severe pain, and which is always turned to be an emergency. What are the causes of acute ischemia? There are two conditions. One is embolytic, another it is necrotic. Embolism is nothing but a small clot of blood which will just go and block the vessel of the intestine, which may lead to the acute abdomen pain. But in this acute bowel ischemia, it is always patient will have the very severe pain. In according to that, when a surgeon or a physician who is examining you will not have an appropriate matching. It is always an inappropriate pain to the condition which patient is suffering from. The other cause can be renal calculi. Even in acute appendicitis, the pain can be radiated to this. The next I will talk about the umbilical region. Umbilical region, the one and major emergency which is more common in the young adults is acute appendicitis. Acute appendicitis, even though the organ is located down towards the right side, the pain will usually started in the umbilical and around the umbilical region. And the other condition which you always known as, which need an emergency treatment and emergency surgery, almost all the time will be needed for an acute appendicitis. The other condition which may lead to the pain in the umbilical region is umbilical hernia and paraumbilical hernia, which is nothing but herniation of the intestinal content which will propel out, which may cause a pain for a patient. Left side, the same thing can be renal calculi, even the bowel ischemia can happen in the left side also. Now let me discuss about what are the few differential causes for the lower abdomen pain. I'll let me know about the what are the region. This is right iliac fossa, left iliac fossa. In between them is the hypochondrial region. What is the most common pain in the right iliac region? As I discussed, acute appendicitis is the major condition, and it is an acute emergency which a patient should seek as early as treatment, so the dreaded complication will be almost eradicated. The other causes can be bowel ischemia can occur in that. Even in few patients, bowel obstruction, that means the lumen which is containing the food can get blocked to some other reason like food particles, even an infection, even if the intestine is not able to move properly, even in those cases bowel obstruction will happen, which is more commonly seen in the right iliac region. Even in the left iliac region, the most common is IBS. IBS means inflammatory bowel syndrome. In that, the most common is ulcerative colitis. Ulcerative colitis is more commonly located in the rectum. So most of the IBS patient who have been diagnosed with ulcerative colitis will be presenting in the left iliac region tenderness and pain, which has to be treated medically. Very rarely patient may be needed surgery for an left iliac treatment. Now let me discuss about the hypogastric region, which is nothing but the lower part of the middle abdomen, which is located in the lower abdomen, which is otherwise known as suprapubic region. Most of the pain occurring to this area is confined to the urinary condition and the urinary infection. The most common patient will have dysuria, that means pain during urination, burning maturation, which in this patient will present as the pain in the suprapubic region, and most of them will be having kidney related and urine related disease such as infection to the bladder, infection to the kidney, or in the renal calculi. Even if the calculi is getting larger in the urinary bladder, even that can present as a suprapubic pain, which is also known as hypogastric region pain. Now I discussed with you regarding the few common condition which is located in the different part of the abdomen. There are further condition which can be just diagnosed by an examination by a physician or a surgeon. So in case of any mild throbbing pain and continuous pain is there, please visit to Athreya Hospital. I am available at any time. Please reach to me. I will help you in curing your disease. Thank you.